Greeting, my friends, and welcome to this webinar, The 5 Insights into Self-Healing. In this webinar, I am going to explain to you how you can heal your health concerns, how you can heal real illness, diagnosed illness, without medicines and without supplements. And I realize that sounds odd. And many people wonder, how can that happen? And I'm going to attempt to teach you exactly that today. So welcome. And this snapshot, or rather this webinar is a snapshot of an 8-week course that I offer, which is called A Course in Self-Healing. It begins on October 7th. And this course it's an 8-session course. It's online, interactive, and you can go to my website, charliecropley.com, to find out more about it. This is going to be a moments from that course. So I'd like to introduce myself here. Who am I? By training, I am a naturopathic doctor. I graduated in 1979 from National College of Naturopathic Medicine, as it was then called. And I moved to Colorado, where I was the first naturopathic doctor in the state. I've practiced here for 40 years now. And I spent my first approximately 20 years as an eclectic, vitalistic naturopathic doctor. I did primary care practice and doing physical exams, gynecological exams, using all manner of laboratory diagnoses, and treating acute and chronic illnesses using non-harmful naturopathic therapeutics such as herbal medicines, homeopathic medicines, acupuncture, spinal manipulation, hydrotherapy, nutrition, so on. And over the years, I moved steadily toward using behaviorist medicine and being a teacher. And today, and for approximately the last 15 years, I have not used medicine, supplements, or therapies other than education. And I believe it to be the basis of all healing, without which little healing really occurs. And that it is also the most powerful, most effective, most elegant, and quickest way to heal yourself. Okay, so let me name to you, what are we going to talk about today? We're going to do 5 insights. The first insight is that illness is wise. Your body wants to heal. The second insight is that there are 4 things that you're doing every day that are destroying your health. Excuse me. Yeah, 4 things. And the third insight is power with versus power over. The fourth insight is the 3 universal medicines. And the final insight is mindful attention, moving closer to our afflictions, our sufferings. Okay, so let's begin, and I'm going to do a screen share here and show you some slides. So let's go to this. Let's see if I've got this happening. There we go. All right. So let's see, here's our first slide that I'm going to show you. Okay, our first slide is our first insight. Our illness is wise. Our body wants to heal. Your illness, what's happening in your body, is wise, and your body wants to heal. I don't know if you can see this clearly, this visual here. This is the naturopathic model of toxemia, and it's shown here as a tree. And what this does is to link our illnesses, which in the language of the 1920s, these are listed up here, tuberculosis and diabetes and cancer and heart attacks and so on. And these are traced back. The fruit of this tree is traced back through the roots of these that could be such things as a leaky gut, hormonal imbalances, adrenal fatigue, and such. And it's leaked back into changes that take place in the sap of the tree or the blood of our body. And these are a loss of vitality, an accumulation, or actually changes in the composition of our bloodstream and our lymph, and an accumulation of poisons in the tissues and the organs of the body. And the roots that lead to this devitalized, poisoned blood are three roots that we will talk of today. And those are the three roots of illness: are ignorance, indifference, and lack of self-control. And the contrary in healing is the three roots of healing are kindness, are truthfulness, and our relationship. So let's look at the theory of toxemia here. And this model has incredible explanatory power. The ability to organize all the facts, the metabolic explanations of what's taking place into an organized, intelligible framework by which it gives us predictive power, therapeutic power to make good decisions and to understand what's taking place. I have used this model through my entire practice. I learned it from Dr. Henry Beeler, the author of Food is Your Best Medicine. And this model, continues today to be validated by everything I've learned over 40 years. And I think you'll find it has relevance for you. So let's see. So briefly in the model, let's look at it this way. Let's do it this way. This is a look at the human body, and I'm going to explain to you a progression of illness from our actions through three lines of defense in our body. And here we're going to focus on eating and the digestive tract, however, knowing that the digestive tract is influenced by our movements, by our thoughts, by our emotions, and by our relationships. So we're just going to use this as one example to illustrate the theory of toxemia. So here we are with the digestive tract, and we're seeing here the human body stripped away so that we can see the organs inside, and two of them. So in terms of digestion, food moves from our mouth till it's expelled from our anus and through an esophagus here into small intestines and large intestines, and from there to our liver, and from there to our bloodstream, and from our bloodstream to every cell in the body. Let's look then. Our first line of defense when we're eating is our intestines. And we get a look here at the circulation to our intestines, how rich it is that every cell in the intestine has its own blood flow going by it that takes up the blood from the food that is digested and takes it from there, as we will show, to from our intestines. If you trace this venous blood flow back from any spot in the intestine, it goes back into larger and larger, flows into larger and larger rivers until it flows into this vein called the portal vein and goes to the liver. Now the point here is that is that the is that food that is digested, and some of that food itself is poisonous. Some of it is turned to poison in the digestive tract, and some of it is wholesome foods, but its next stop is the liver. And after the liver, the liver purifies the blood, leaving the nutrients in it and taking out the poisons, so that what goes past that, because when it gets past the liver, it goes to the heart and is pumped to every cell and tissue in the body. So what this shows is the changes in our blood that take place. And all I'm intending to show here is that here's a bloodstream with a combination of nutrients in it and poisons in it. And as this bloodstream maintains health, then all the cells that are nourished and cleansed by the bloodstream maintain their health. And similarly, cells, as the bloodstream becomes toxic and poisoned, then those cells become toxic and poisoned. And so what happens then when the blood begins to change is that we go to our third line of defense, which is it brings about hormonal imbalances. That may be hyper or hypothyroidism. It may be changes in a woman's level of estrogen, a man's level of testosterone. It may be changes in our adrenal stress hormones. Hormones throughout the body are changed by as the quality of blood declines. So going forward, we can see that this is an example. The bloodstream in naturopathic medicine is the river of life. And when the river of life becomes polluted, it pollutes the communities, whether those are cells or people that live around there, and sickness and disease ensue. When the river of life is pure and clean, it nourishes alive, healthy communities and alive, healthy bodies and alive, healthy cells. So let's see here. Here we go. Let me ask you, what then happens when our body, when our bloodstream becomes polluted and our cells begin to degenerate? What happens is that the body has a completely wise, intelligent, caring mechanism for preserving its health. And that mechanism, odd as it may seem, is sickness. And the body doesn't just develop cancer, rheumatoid arthritis in response to a short time of living in a fashion that weakens and pollutes us. The body is wise, and it first begins with responses of acute illnesses. And acute illnesses are self-limiting illnesses, things like flus and fevers and colds and bronchitis and bladder infections and diarrheas and sinus infections and middle ear infections in children, right? Acute illnesses, they will go away. They won't, and then the other type of illnesses are chronic illnesses, and those are what plague our country today. Those are diabetes, heart disease, strokes, cancer, autoimmune diseases, dementias such as Alzheimer's. Okay, so back to that illness is wise. This theory of toxemia demonstrates that illness is wise. Think about it this way. If you have a hangover, and we've been trying to cure hangovers ever since there have been human beings experiencing hangovers. If you have a hangover, we have yet to find a cure for it, right? And why have we not been able to find a cure for it? Because in naturopathic medicine, the hangover itself is the cure. What's a hangover the cure for? That's obvious to us. We all know it's from poisoning ourselves with alcohol. If we move to other acute self-limiting illnesses, such as bronchitis and middle ear infections in children, it's a little harder to discover the cause. It's not as obvious as it is with a hangover. But in the hands of a naturopathic physician, we are trained to, that's what we do, is to discover what is causing this, because illness has real causes to it. Now, if we do not discover the message of a hangover, shall we say, or any acute illness, we don't discover the message of a hangover, and we take ibuprofen and other medicines for it, what happens is that we have not discovered the causes, and so the drinking continues along with the poisoning due to the toxic medications that we're using, and our symptoms grow worse. They become more frequent and they become more severe until we develop a cirrhosed liver and die of it, right? In the same way, the suppression of bladder infections and bronchitis and skin disorders lead to disease that does not go away. And naturopathic physicians understand that by suppressing our acute illnesses, that they lead to chronic illnesses. And we want to remember suppression. In fact, in suppression in acute illness, you suppress a bronchitis, and the bronchitis, then you haven't made the body any healthier. The bronchitis then manifests as a diarrhea. You suppress the diarrhea, and the diarrhea will come out of your skin, right? And you suppress the skin, and it will come out in your urinary tract. So let's go. The body, illness is wise. The first insight, illness is wise. Your body wants to heal. You see that, and it's so in chronic illnesses as well. Now, let's go back to our screen share. And I want you to see here that we have, I describe as 4 bodies. We have our physical body, which we've largely talked about. We have our emotional body, our heart, where we have feelings and emotions. We have our mental body, our mind, where we experience concepts, ideas, thoughts. And we have our social body, in which we experience relationships with other people. I point this out because in A Course in Self-Healing, you will learn to listen to the wisdom of illness, to the language of each of your bodies, right? Each of our bodies speaks to us constantly, and they know how to heal, and they're trying to communicate to us how to heal by their symptoms. So one of the questions that I ask my patients, and that we ask in the course, and we can begin now, I'll ask you, what is it like for you living in your body? And my patients describe that to me in detail. And you can look now, but what is your experience? Is it sad for you? Is it anxiety producing for you? Is it frightening for you? You may be afraid that you're going to die, or that you'll live like this for the rest of your life. Is it disappointing to you? Does it make you angry? What's it like for you living in your body? You feel cheated, betrayed. Now, pause for a moment and ask yourself, what do you think it's like for your body living with you? Is it a wonderful experience for your body? Does she feel loved? Does she feel cared for? Does she feel listened to, understood? Good question, huh? If you consider your body is the wisest instrument on this earth, the pinnacle of evolution. She makes eyeballs. She beats a heart. She reproduces herself. She defends herself. Do you think that a creation that wise is unable to communicate with you? She's communicating to you constantly. And this understanding gives you a source of real wisdom to heal yourself. Let's go on. Okay, our second insight is this, is that there are 4 behaviors that we're doing every day that determine our health and happiness. It is our behavior that determines our health. So these 4 behaviors are our ways of eating, our ways of moving, our ways of thinking, and our ways of relating. Our illness in naturopathic medicine is a message to us about these 4 behaviors, about the ways that we live. This interpretation of illness gives meaning to your life and gives meaning to what you do. And it gives you power to work with your illness. Let's look at each of these behaviors. So, our first behavior, eating. Eating is our relationship with food and our relationship with hunger. Now, in A Course in Self-Healing, each of these 4 behaviors, eating, moving, thinking, and relating, we work at them, right? We're out to heal ourselves. And this is how we heal ourselves, is by healing our behaviors. And we do 2 things. We do what we call focused practices, and we do spontaneous practices. Focused practices are a daily practice of this behavior. And we practice all 4 of these behaviors. So with eating, you may choose to do a paleo diet, Whole30 diet, a plant-based nutrition diet. You may do an elimination diet to test yourself for allergies. This is up to you. This is not a training in nutrition. This is a training in your relationship to food and hunger. So the point is that you are doing a focused practice of your eating in the course. That focused practice for a day may be simply having 2 servings of vegetables or reducing down the amount of coffee that you eat, but you're practicing that every day. The other practice that you're doing will be a spontaneous practice. And a spontaneous practice is a practice that you do in the moment, that takes you no time and that calms you and gives you energy. So a spontaneous practice, not in this case of eating, but a spontaneous practice would be, well, at eating would be to pause and take 3 caring breaths. That would be a spontaneous practice that returns you to your desire to care for yourself before you begin eating. Okay, so eating, my mentor, Henry Bila, wrote a book entitled Food is Your Best Medicine. I've taught repeatedly a course called Food is Your Best Medicine, and it's based on Hippocrates' aphorism that food, above all else, is your best medicine. Food is, it's so powerful, just incredibly powerful. Learning to eat a wholesome, nutritious eating regimen that nourishes your body. What is that for you, and discovering that? Learning how to find out what foods you are sensitive to and allergic to. Life-changing. Learning how to not eat and how to fast and allow your body to rest and purify itself. Enormous learnings in eating. And consider, I think for most people, most of us, or many of us would say, I know what to eat, or I certainly can name 3 things right now that would be better for me in my eating, but I can't get myself to do it, right? Eating is much more than a physical act. It involves all of our bodies. So if you consider emotional eating, right? You know that your eating can be driven by your emotions. Secondly, what about social eating and your eating being influenced by the company that you're with, whether it's your own family or whether it's going out with friends or back to be with your family of origin? Eating is influenced by being tired, by being premenstrual, right? By really everything in our life influences our eating. And you will learn a new and caring relationship, and to be able to be with your cravings and your appetites. And healing cravings is one of the main works in A Course in Self-Healing. Let's look at movement. Movement, our relationship with strength, our relationship with flexibility, our relationship with endurance, right? Movement is a way that we heal our body. It's a relationship with our physical body. Now, we are all already engaged in movement, right? We're already moving, just like we're already eating. We are both healing and harming ourselves by these incredible medicines. So again, in the course, A Course in Self-Healing, you will be practicing movement. Have a focused practice of movement that you do every day. Your movement and your focused practice may be for 1 minute in the morning or whenever it is, but you will begin, and every day you will have a focused practice of eating, of movement, of using your mind, and of being in relationship. Practices that you're doing every day, even if you devote 1 minute to each, and you will grow those. You will grow those because they'll prove themselves to you, and you have something that you can do that by which you know you are benefiting yourself, and you will continue to grow. You will also have spontaneous practices, and I want to show one of those to you right now. It goes like this. So pause where you are, unless you're driving a car right now. Pause and notice your body. And we're going to do 3 things. The first one is take 3 breaths into your body with the intent of loving your body, of helping her, of calming, relaxing yourself, and restoring your energy. Just continue breathing as we walk through this, the other parts. I'm instructing you in this. The second is that relax your body. Just allow your body to relax. Allow your breathing to relax. And the third is bring poise and dignity into your body. By your presence, uncross your legs. Sit like a queen, like a king. Sit beautifully. Align your body so that you're in harmony with the laws of physics that govern your body and you're not squandering your energy. And breathe. And say to your body, I love you. I remember you. You are precious to me. Feel my love in this breath. Take another 3 breaths and feel your caring and your desire to heal your body, and allow that to be present in your breathing and in the way you posture your body, the way you inhabit your body. Good work. Our next behavior is that of thinking. Our relationship with thought and emotion. And like all our behavior, we are always and already thinking and feeling emotion and expressing emotion. Largely, we are governed by habit. And for most people, those habits are destroying them and destroying their health. Our thinking, our emotional body is tied up through our central nervous system, our sympathetic nervous system, our parasympathetic nervous system, our hormonal system, our neurotransmitters. It affects our entire body, our immunity, our circulation, our breathing, our digestion, the dilation of our pupils. Everything in us is influenced by our thoughts and emotions. Some to think about. So, in A Course in Self-Healing, you're going to practice this. You're going to practice. I'm going to encourage you to develop a practice of being with your mind and your emotions, to take time in the morning to journal or to meditate, a practice for healing your mind. And you will be given journaling assignments and assignments every week. You have meaningful assignments, just like what we're talking about, things that make sense to you and that make an immediate difference to you. A journaling assignment like, what is it that you want, that you most want in your physical body? What is it that you most want in your mind? And what is it that you most want in your relationships? And then following that, what is it that you do not want to have happen? What are you afraid might be happening in your body? What is it that you don't like, that disturbs you, that you want to be free of? How do you suffer in your mind and your emotions? What do you fear there? And then similarly in your relationships, what do you desire and what do you fear and not want and hope does not happen to you? This assignment gives meaning to your life. You are defining what means something to you, what you really want and what you really don't want. And then A Course in Self-Healing shows you how to harness that to real behaviors, real actions that make your life meaningful and move you toward health and away from disease, toward happiness and away from unhappiness, right? An example of a spontaneous practice that you will be taught here is to do check-ins with yourself, beginning just to check in and say, Charlie, how are you doing? Just tell me how you're doing in this moment. And I might check in and say, in this moment, I feel a little bit of a hunger, but it's like an excitement in my stomach and through my chest. And I feel inspired and happy. It might be whatever it is. These check-ins. I have a patient who has ulcerative colitis. And she says that doing check-ins with her and finding out how incredibly stressed she is and bringing compassion to that stress has enabled her to thereby not eat out of stress and to bring about profound changes in her ulcerative colitis. Okay, let's go on to our third one, the skill of relating. Again, we are already relating and largely relating habitually. Relationship being, how do we give and receive love with other people, and how do we understand others and be understood by others? The skills here, or the challenges, are formidable. Look, above all, perhaps above all, we need to be loved, and we need to be loved by others. And it makes us incredibly anxious when we think that other people are judging us, don't like us, making fun of us, and excluding us. It's terrible, and it causes us tremendous anxiety. I have a patient who recognized for herself this. She came to me because she was being debilitated. Really, her life haunted and ruined by her fear of what other people thought of her. And she could barely speak because when she felt on the spot with other people, she felt that when she was conversing, she felt that they were judging her and that she didn't know what to say. It was terrible for her. What she discovered, she said, here's what I do. I abandon myself and I go over and I end up in somebody else's head thinking about how they are judging me. And I have no power to take care of myself because I'm so afraid of that. I'm over in their heads, right? She has learned to pay attention and put her attention on herself rather than giving her power to what other people think, and coming back to how she actually feels and caring for her own anxiety by loving herself. Such is the power of relating. In the course, you're given these great assignments. You're given assignments like some of what we've already spoken of. And you're asked in your study, go and have a conversation with somebody else about this. First, have this conversation with yourself. Apply to yourself. Look at yourself, how you are socially anxious, how you compare yourself to others, and many other things. And then go have the same conversation with another person. And in the course, you have the opportunity to do the course with a partner. So have the course with your partner. If you're a doctor, excuse me, have the conversation with your patients. Okay, let's go forward. Okay, briefly here, a case history. A young woman with tinnitus. She could not sleep. She said, I'm exhausted. My heart's racing when I wake up in the morning. I've gained 24 pounds in the last year, and I've had 9 colds and infections in the last year. I went to the emergency room twice with anxiety, where I was given anti-anxiety medications. I've been to a alternative doctor who diagnosed me with having EBV, Epstein-Barr virus, and that I'm taking different herbs and supplements to counteract this. So listen to this. I took her case. This is an example of relationship. She said she's 24 years old. When she was 14, her mother was diagnosed with cancer. When she was 14, her grandmother passed away from cancer. At the age of 18, her parents' divorce began. And this is also when she began to experience her tinnitus to small degrees and not every day. And then at the age of 18, she found messages from men on her father's computer and found out that her father was engaged in sexual behaviors that she found to be absolutely disgusting. And then it was after that she went to the hospital, to the emergency room twice. And then just before her coming to see me, she broke up with her boyfriend, her longtime boyfriend. And she said, it was so bad that I was sick to my stomach. She took time off and went to Europe and spent time there. And that was where she gained 24 pounds and was sick 9 times when she came to see me. Relationship has a little influence on this. We went back and did work on the terrible emotional injury that she had experienced primarily with her father, and her relationship with men, where she could not trust men and ever felt that they would be cheating on her. As she steadily improved, she lost all her weight. She no longer got sick. She was able to sleep, her energy returned, and she was drawing links and is now at present drawing strong connections between her tinnitus and her relationships and her emotions. Beautiful work. Okay, so the question, the $1 million question, we go nowhere further if the question is, how do we change our behavior? And I want to show you some things here. Do you know that only 6% of Americans consistently engage in the top 5 behaviors that they know are going to benefit their health, are essential to their health? That only 8% of people follow through with their New Year's resolutions. They resolve they're going to change their behavior. 8% follow through. And do you know that 80 to 95% of people who lose weight gain it back because they cannot sustain the changes? If heart doctors tell their seriously ill patients, you are going to die if you do not begin improving your eating, getting regular exercise, and stop smoking, do you know what percentage of those people are able to make those changes? It's 1 in 7 people, and they're literally facing death, right? The challenge to changing our behavior, you know it. To have this conversation, just think now. how daunting it is and how difficult it is. So, how this is the elephant in the room, the sine qua non, meaning without which, if we do not address this, if we do not find how to change our behavior, everything after this is hopeless. All of us already have. I ask my patients, what's your strategy for changing? And we are all operating under unconscious strategies. And those strategies are usually this. One of them is simply trying harder. You can imagine trying to improve your golf swing by doing nothing but trying harder. The other strategy is that of being mean to ourselves, right? Of criticizing ourselves, judging ourselves, threatening ourselves, and withdrawing our respect and love for ourselves. This is, we are innately self-healing, right? We are innately endowed with an instrument that tells us the path of what is right and good for us and the path of what harms us. And that instrument is called conscience. Pause for a moment and consider your relationship with your conscience. For many of my patients, their conscience is a demon that haunts them, that shames them. They can scarcely listen to it, and they try to suppress it with wine or coffee or porn. Avoid it. But our conscience is our moral sense and our guide. And as we develop a caring relationship with our conscience, then we find ourselves knowing what to do and with a tool for guiding us. Okay, so now we face, how do we heal our behavior? The greatest question that we face in our life. And this leads us to our third insight of power over rather than power with, of being nonviolent. The Hindu word for this is ahimsa, being practicing nonviolence. And in this slide, you see the warring behavior here of power over, dominating, controlling, in contrast with the nonviolent, loving behavior of befriending. In the course, so we discuss in the course, there's an entire session entitled The War Within, that we are at war with ourselves. We want to lose weight and we want to eat sweets, right? We want to be happy and cheerful, and we criticize ourselves bitterly. We're at war. We have these warring factions. And in the course, we learn to listen to both of these factions. And in fact, as you see here with Gandhi kissing this little girl, what we learn to do, if we take something, let's take being critical towards ourselves. Being critical is a form of dis-ease, right, in our mental body. Remember, our illness is wise and our body is trying to heal. Our mental body is trying to heal. We are trying to take care of ourselves in the dysfunctional way of criticizing ourselves. And what we learn to do is to develop the attitude of nonviolence, of power with rather than power over, of actually befriending our self-critic like a wise, caring parent. We come to the afflictive parts of ourselves like a wise, caring parent. and we learn to understand ourselves and to befriend ourselves. And this is the means by which we heal. Power over, in contrast to power with. Next insight, the fourth insight. Wow, this is so fabulous. There are 3 universal medicines. They are compassion, truthfulness, and relationship. Compassion means love. It means kindness, right? Truthfulness means understanding ourselves, being honest with ourselves, gaining clarity. Relationship is everything. Relationship is being in relationship with, being able to communicate with. Relationship is having community. This is our strategy for healing anything. So this is our strategy for healing MS. This is our strategy for healing a leaky gut. This is a strategy for healing overeating and food cravings. This is the strategy we apply to criticizing ourselves. And this is the strategy that we apply to difficulties raising our children or to disagreements with our spouse. These 3 medicines. All right, so what do these look like? The first medicine is the medicine of kindness. So these are universal medicines. These are the nature of the universe, and they are our own true nature. Kindness is to us like air and water and sunlight to a plant. We have a biological need and an innate yearning and desire for kindness. We cannot live without kindness. Without kindness, we become sick. And we are tracing real illness, right? Illness, your rheumatoid arthritis, to 4 behaviors, your eating, movements, thinking, and relationship, and to the need for changing our behavior, and to the strategy of how do we change our behavior by being kind to ourselves. And without kindness, our behavior becomes sick and our bodies become sick. So kindness is what enables us to do the good that we are trying to do. I will tell you that if you are trying to eat less sweets, part of your strategy will be to catch yourself in the exact act of eating the sweets and say to yourself, honey, hear me. If you eat sweets for the rest of your life, if you grow overweight and become diabetic, I am going to love you always. I love you now. I will love you no matter what the outcome. In this moment, as you are eating this brownie, feel my caring for you. That's a small example of kindness, the universal medicine of kindness. Next medicine is a medicine of truth. Again, we all have a biological need, an absolute biological need and yearning desire to know the truth and to experience what is true. Without truth, we become sick. Your sickness, the problems, the real diagnosed illness that you have, the root cause of it is a lack of truthfulness in your life. What does that look like? Is it true for you that you want to eat better, right? Is it true for you that you want to care for yourself through exercise? What is true about why you don't? Can you tell yourself the truth? Can you explore to find out that truth? The truth is that you face a challenge. Let's say a challenge in eating. You face a test, and that you can face the challenge of drinking wine to excess, coffee to excess, eating excess sweets. That is an absolutely necessary challenge for you to face in your healing. And you will not, that test will never go away. You can take it whenever you want, but it awaits you. Now, knowing that is knowing the truth, right? You sense that you know that that's true. You also know that there is nobody else who knows the struggles that you face with making these changes, who knows the difficulties it is for you. These are your unique challenges. And you also know that there is no one else who can do this for you. There are real challenges that you face in your life, and they're daunting. And this is the medicine of truth, is to realize that by ignoring or suppressing what's true, that the harm accrues steadily like interest, and that your suffering grows steadily worse, and that there is no answer except to cease doing the actions that harm you and to begin doing those that heal you. And you know in truth that this is what you want to do, that appeals to your truth. And what I'm telling you is I'm going to show you a way how to do this, right? How to do this. I'm going to put in a plug here for a course in self-healing. It begins October 7th. It is 8 sessions, online, interactive, teaching you how to heal your health problems, real illness, without medicines and without supplements. Heal it by the things that we're talking about here. Okay, let's go. Third one is the medicine of relationship. Again, we have a biological need. We can't live without the love of other people. Without community, we become sick. I love this saying. The greatest thing you'll ever learn is just to love and be loved in return. The greatest thing you'll ever learn is just to love and be loved in return. So here's an example of the power of relationship. There's a study that was done that's called the ACE study. It stands for Adverse Childhood Experiences. So these experiences are things like physical abuse, sexual abuse, emotional abuse, physical neglect, emotional neglect, exposure to domestic violence, household substance abuse, and household mental illness. And this test is 10 simple questions. That's it. You answer these 10 simple questions as to, did you experience this in your life? And the questions are like, did a parent or other adult in your household often or very often swear at you, insult you, put you down, or humiliate you, or act in ways that made you afraid that you might be physically hurt? Right? Did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks, or were injured. Goes on to say other things like that. Was your mother's stepmother pushed, grabbed, slapped, or had something thrown at her? Another question. Did you live with anyone who was a problem drinker or alcoholic or used street drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? Did a household member go to prison or die? These are the questions. Now look at this, check this. These are the results, and I don't know if you can see this. These are the results. This first one is, let's see, gotta go back to, the first one says that childhood experiences of the ACE test, of scores in the ACE test, correlated with adult alcoholism. This is no experiences, just one answer yes on that test. Look how it rises. 2 answers, 3 answers, 4 answers. Look at the rise in alcoholism as a result of suffering in relationship. Look at this one. Gotta go back again. Look at this one. Childhood experiences that underlie chronic depression. Similarly, look at the rises in chronic depression. Do you struggle with alcohol? Do you struggle with depression? Here's a score with antidepressant prescriptions. It goes on to talk about correlations with sexual promiscuity, drug abuse, inability to keep a job. Relationship is universal, our need for love, right? Okay, so let us go forward. How do we practice relationship in the course? Oh my gosh. Look, everything we do in the course is relationship. What is our relationship to our physical illness? What is our relationship to our physical body? What is our relationship to our emotional body, to our emotions, to our sadness, to our depression, to our anxiety? Do we abandon ourselves, or do we form power with, right? Are we like a kind parent to our suffering? Relationship is everything, everything. Plus in the course, you can do the course with another person, right? And have their support and accountability, and there's a whole system for that. All right, the final insight, mindful awareness, moving closer to discomfort. We have alluded to this throughout. If you have irritable bowel syndrome and you have gas, bloating, pain in your intestines, do you throw supplements at it? Do you take probiotics, enzymes? That's fine to do this. It's fine to do these. However, do you move closer to your digestive tract? Do you move closer to your sore shoulder? Do you move closer to your anxiety? Moving closer in your body. You can take a moment and do our threefold step. Just pause, take one caring breath, come into your body, relax, and allow your body to conform to poise, to dignity. And then you could breathe and come close to the pain in your digestive tract or the pain in your shoulder. This is the process of coming closer. Now, okay, so those are the 5 insights. The 5 insights being, your illness is wise. Your body is trying to help you. The second insight, there are 4 behaviors by which you either create illness or heal your suffering: eating, moving, thinking, and relating. The third insight, power with versus power over. The fourth insight, there are 3 universal medicines: kindness, truthfulness, and relationship. And the final insight, mindful awareness. Come closer to your suffering. Okay, so the question that we raise here, talking about A Course in Self-Healing, is I'll just ask you the question: if you were to do the course, what is it that you would want to learn? Hang on, I'm making an adjustment here too, so that I can see what I'm talking about. If you do the course, what would you want for yourself? What is it you want in your body? What is it you want to heal in your behaviors? Think about what you want if you were to do the course. And then next is, clearly the course has so much benefit to it. I trust that you see that benefit. One of the things that might keep you from doing the course is doubt or self-doubt. And you can, and I invite you in this moment, to have an honest relationship with your doubt rather than just be run by doubt. So you may doubt that this really works, although I don't think you could possibly doubt that this really works if you've listened to what I've said here. So I'm going to dispense with that. You're confident that this really works. But you may doubt that it would work for you or that it could work for you. And I ask you to think and to consider, you're not exempt from the laws of the universe. You inside yourself long to be well. That is true and real for you. And your desire to do that, I've shown you how to do. This will work for you. You absolutely can change your behavior, and in so doing, change the illnesses and the suffering that you experience. You may doubt that you'll actually do the course, that you'll follow through with it. Investigate that. Are you going to allow yourself to be run by that doubt? You can see here, you can use the course to develop a healing relationship, power with your doubt, to understand your doubt. Why do I doubt that I'll follow through? Because that's what you've done previously? There's a lot to be said for that. But the only time you can change is now. You may doubt, you may be concerned about money. I would say to you that this course, the 8 sessions of this course, if you were to spend the same amount of money with me in my practice, you would spend over $2,500. Whereas in the course is now $395. Remarkably better investment. And the money that you spend, really think of it. I mean, if your energy goes up 20%, if you're less anxious, if you're sleeping better, if your pain goes down, oh my gosh, what's the comparison? And lastly is the question of time. Time is a real question. Again, we all take on our relationship with time in the course, form a new and healthier relationship with time, so that instead of just being run by time, you consciously look, how do I want to be spending my time? and you implement strategies, not just time management. We've all done that, or a lot of us have, but strategies, ways that go through your day that actually save you time and energize you and give you more time. Okay, so this is it. And what it comes down to is this. Here's what we're changing. This is a quote by Buddha. Desiring only health, we shun the causes of health. Seeking only to escape pain and suffering, we are drawn to the causes of suffering like moths to a flame. We long to be healthy, we long to be happy, and yet we do harm to ourselves. We don't want to suffer anymore, and yet we do the things that cause us suffering. This is true. Every one of us longs for health and happiness and to be free of suffering. In A Course in Self-Healing, you learn how to harness that desire into real action that brings you the health and happiness that you want. I thank you so much for being with me. It's been a gift to me to be able to share this with you. Thank you.